Management of Helicobacter pylori infection typically involves a combination of antibiotics and acid-suppressing medications. Here's an overview of the best management strategies. Testing for H. pylori. Before treatment, confirmation of H. pylori infection is essential. This can be done through various methods, including breath tests, stool antigen tests, blood tests for antibodies, and endoscopic biopsy with histological examination. 2. Antibiotic therapy. Antibiotic treatment is the cornerstone of H. pylori eradication. The choice of antibiotics may vary based on local antibiotic resistance patterns, patient allergies, and previous antibiotic exposure. Commonly used antibiotics include clarithromycin, amoxicillin, metronidazole, and levofloxacin. Triple therapy, which typically includes a proton pump inhibitor, PPI, along with 2 antibiotics, is a standard regimen. 3. Proton pump inhibitors, PPIs. PPIs are used in H. pylori treatment regimens to reduce stomach acid production, which enhances the effectiveness of antibiotics and promotes healing of gastric mucosa. Commonly used PPIs include omeprazole, lansoprazole, and esomeprazole. 4. Bismuth subsalicylate. Bismuth containing quadruple therapy, which includes a PPI, bismuth, and 2 antibiotics, usually clarithromycin and either amoxicillin or metronidazole, is recommended as an alternative first-line treatment regimen. Bismuth has both antibacterial and cryopreservative. 5. Duration of treatment. Standard treatment duration is typically 10 to 14 days, although shorter durations may be effective in certain cases. Extended treatment durations may be considered in patients with severe gastritis or treatment failure. 6. Follow-up testing. After completion of treatment, confirmation of H. pylori eradication is recommended to ensure successful therapy. This can be done using non-invasive tests such as urea breath test or stool antigen test, typically performed 4 to 6 weeks after completing treatment. 7. Management of complications. In cases where H. pylori infection has led to complications such as peptic ulcers or gastric malignancy, additional management strategies may be necessary, including endoscopic interventions, long-term acid suppression, or surveillance for malignancy. 8. Patient education and counseling. Educating patients about the importance of adherence to treatment regimens, potential side effects of medications, and the risk of antibiotic resistance is crucial for successful management of H. pylori infection. 9. Consideration of reinfection. Addressing factors that may predispose to H. pylori reinfection, such as living conditions, hygiene practices, and socioeconomic factors, can help prevent recurrence of infection. 10. Consultation with a specialist. In cases of treatment failure, antibiotic resistance, or complicated presentations, consultation with a gastroenterologist or infectious disease specialist may be warranted for guidance on alternative treatment strategies. Conclusion. It's important to note that the management of H. pylori infection should be individualized based on factors such as patient characteristics, antibiotic resistance patterns, and local treatment guidelines. Therefore, it's advisable to consult with a healthcare provider for personalized management recommendations.